So when wart patients used to come to see me, I was always really frustrated because I knew I really couldn't give them an honest answer and say to them, hey, we know we can get this better in a certain amount of time. Because sometimes they would heal and sometimes they wouldn't, because we were dealing with a virus, and a virus that was really stubborn. A lot of times we would try different modalities and they would cause them to have discomfort or pain, and they had to go through sometimes things that were quite uncomfortable, and it wasn't always the best scenario dealing with patients. Whenever someone comes to see me, I want to make sure that I can give them the best possible outcomes. And when I was dealing with the older type of treatments for verruca, for warts, they didn't always work out that well. So it made me feel very frustrated as a clinician, especially as a sports medicine provider. I had individuals who needed to perform at their highest levels and they weren't able to do it, albeit a runner or a swimmer or a gymnast. They just didn't feel very comfortable sometimes having to deal with the old type of methodology. When I had a patient would come in who had warts for long periods of time, recalcitrant type warts, we would have to tell them, look, these are the different options that we have, and none of these options are going to be great. We could maybe try a caustic chemical to put on there, like salicylic acid, or we could try to freeze it, or we could even have to try to cut it out. All of those have their own issues. They can be uncomfortable, painful, they could cause you time away from your activities that you enjoy doing. That was really frustrating for me as a clinician. With Swift, honestly, when I see a wart patient on my schedule, I get a bit energized because I know that I'm going to give them something that's science tested, peer reviewed. I know that I can tell them, look, we're going to give you something that's an innovation where we're actually going to not just fix the skin problem, but we're going to cure the main reason why you have it, which is human papillomavirus. We're going to cause immunotherapy to get this to go away. So I get really excited to be able to share that with them and tell them, within a few months, this is going to resolve. In my practice, I like to find things that are new and great and really make a difference. And when I heard that this came out, the Swift treatment for microwave therapy for verruca, I was honestly very skeptical. I'm like, oh, it's another modality. It's going to cause heating or burning or whatever. But the more I learned about it, the more I read about it and the research behind it and how it does cause this cascade of events that causes immunotherapy, I was in. My chips in the middle of the table and I said, let's give this a go. Let's see how we can make these patients better quicker. The patients have responded overwhelmingly positive. They are also very skeptical, but you can see my passion. And when they see my passion that I really believe in this, they have also gotten better quicker, I think, because they're motivated to get better and they're motivated to come back and to continue with the treatment. My success rate now, honestly, is in the high 90%. I don't think there's any wart out there that I can't get rid of, to be quite honest. Even the toughest ones out there, we've learned that with time and with the right techniques, we can get these better. So Swift has actually changed my practice. It's been a game changer by all means, in the fact that now I'm being sought out for my expertise, not only in warts, but in other things as well. Other physicians are sending to me, other podiatrists are sending me, dermatologists are sending to me, and most importantly, other trusted patients are sending me their trusted friends and family. So it's been really a positive experience all around. Many times patients, or at least other doctors, get concerned that, will the patients pay for this? I find that without question, when I explain it to them and explain it to the patient, like, look, these are the options you had beforehand, and those options are less than 30% successful. Here's a new option that we're able to do, and we're getting way into the 90% success rate. And that's been through studies after studies that I myself actually helped conduct. So I know it's going to make a difference. I tell them that, and they're usually motivated to continue with this because they also have been frustrated. These aren't usually patients that come to me having one little wart. They're patients who've been dealing with this for years and they've had the same treatment over and over again. And it's almost been like the definition of insanity, expecting to see a different outcome. But now I could say, look, this is a different way of going about it, and we're going to get rid of this and never have it come back again. So one of the other things that we use Swift for is something called intractable plantar keratosis, or IPKs. And there are these corns that form in the bottom of the foot. And with time, I've started to look at these more. I used to just start taking pictures of intractable plantar keratosis themselves, and I would see that when I started looking at them closer and closer, that there were viral components to those IPKs as well. I've been having positive success after treating these in the same mannerism that I was treating the warts. And usually patients will say is that the first thing that they notice is that the pain goes away quickly. And these are individuals, when they have IPKs, they usually have to come in on a regular basis for routine debridement to get them cut out or scooped out, curetted out. And now they don't have to do that as often. So in my practice, I've been doing this for over 30 years, and I feel a lot of times that as clinicians, our hands are tied by the fact that we have to treat patients by what insurance will give you. And it's leaving off a lot of other options that might be really positive. So I've gone more and more towards cash-based payments and cash pay type of treatments, and offering patients, look, you have this whole gamut of other things that are available that might be much more beneficial than what your insurance covers. Explain it to the patient. They're more than happy to spend the money if they know that they're going to get a positive result. Hey, this is Dr. Rob Conenello from Orangetown Podiatry, and I've been in practice here for over 30 years. And one thing that I really like to offer to my patients are innovations. One of the innovations that we utilize are how do we treat plantar warts. We call them verruca. We use something called a swift microwave. It's been a game changer in my practice. We're able to take the worst of lesions that come in that are painful, uncomfortable, keep you from reaching your goals, and utilize this new microwave therapy to make a difference in your life. We get rid of these lesions, not for a temporary period of time, but forever. It causes you to have an immune response, and forever and ever you no longer have to deal with these frustrating warts that come and bother you. So come to Orangetown Podiatry and check it out.